Hello, everyone. My name is Bev Chapman, and I'm going to do a presentation on African American women and breast cancer. According to the American Cancer Society and Susan G. Komen, 1 in 8 women in the U.S. will be diagnosed with invasive breast cancer. That is breast cancer that has moved beyond the ducts and the lobules. Every 2 minutes, one case of breast cancer is diagnosed in the U.S. According to Susan G. Komen's Community Profile Report for Nebraska, in Douglas County's northeast quadrant known as North Omaha, Douglas County has a poverty rate of 8.6% overall, but in that north quadrant of Omaha, it has the highest concentration of African Americans, and the poverty rate there is 29.6%. African American women cancer death rates in Nebraska is 227.6, and in the county as a whole it's 22.1, and the whole state of Nebraska is 20.2. African American women are likely to be diagnosed. Sorry, that's my next slide. African American women are likely to be diagnosed with triple negative breast cancer, which is a very aggressive form of breast cancer. After treatment, 1 in 4 will have a second cancer diagnosis. The article study finds Black women have denser breast tissue than white women, states more research is needed to explore what extent breast tissue density mediates breast cancer risk and breast cancer outcomes. The outcomes could determine based on the breast density who might need supplemental screenings. So denser breast tissue makes it hard to spot the cancer on the mammogram. So the outcomes could determine, based on breast density, who would find these supplemental screenings, like maybe an ultrasound. Although the breast cancer incident rate is higher in white women, the mortality rate in African American women is higher than any other race in the U.S., as you can see from this graph. Age does play a role in breast cancer diagnosis. After the age of 65, a woman's risk of being diagnosed with breast cancer is very high. Breast cancer incidence and mortality rate is slightly higher in Nebraska when compared to Iowa. When compared to the U.S., Nebraska's breast cancer incident rate is higher, and Nebraska's breast cancer mortality rate is higher. According to the Centers for Disease Control, female breast cancer rates in Nebraska are 124.1, and the U.S. rates is 124.7. The female breast in situ rates are 27.1 in Nebraska and 30.4 in the U.S. Disparities of health in the African American community: lack of or no health insurance, fear of healthcare professionals, fear of cancer diagnosis, comorbid diseases, low income. All these factors are risk and genetic factors coupled with detriments of health within the determinants, of health within the African American community could contribute to these rates. Some disparities are access to health care. According to the article Triple Negative Breast Cancer in African American Women, disparities versus biology are comorbid diseases such as diabetes, obesity, hypertension, barriers blocking access to health care such as no health coverage. Education plays a role, cultural barriers, unsafe neighborhoods, for example, exposure to carcinogens in the neighborhood and health metals. Heavy metals, sorry. Early detection is the key to beating cancer. Women before the age of 30 should have a baseline mammogram. If there's a history of breast cancer in their family, or if they have breast cancer risk factors such as the BRCA1 and BRCA2. Causes for concern are nipple discharge, irritation, swelling, dimpling, any lump, inverted nipples, redness, and skin thickening like an orange peel. And another breast cancer risk factor is weight, being overweight, your diet, what you eat, if you consume fats and processed foods, a family history, breast biology, meaning the density, exposure to estrogen, stress and anxiety, age, and smoking. The types of cancer, subsets of cancer, the BRCA1 and the BRCA2, it might be breast cancer 1 and breast cancer 2. It's a gene mutation. HER2, which is human epidermal growth factor receptor 2. Triple negative breast cancer, which is ER negative, PR negative, and HR2 negative. ER negative breast cancer can be positive or negative, and PR breast cancer can be positive or negative. What these are the BRCA1 and BRCA2 are gene mutations, and they only test for that if you're at risk for it. Like if you have if you've been diagnosed or someone in your family. The HER2 positive is the human epidermal growth factor receptor type. It's a protein that they find that's positive. I don't know if it binds. I'm sorry. Triple negative breast cancer is the estrogen receptor, the progesterone receptor, and HER2 all negative. And that's a very aggressive type of breast cancer. And just the ER breast cancer is estrogen receptor, and the PR is the progesterone. The history of breast cancer, the first time it was ever mentioned was in 3,000 to 25,000, I don't know, BC, on the Egyptian papyrus. In the 16th and the 18th centuries, the Enlightenment period era brought advances in understanding anatomy and diseases. In the 19th century, physicians there thought that cancer was caused by blood, phlegm, yellow bile, and black bile. And the understanding was that metastasis was through blood and lymph vessels, and acknowledged, because prior to that, they didn't believe in that. Early treatments for breast cancer. Staging was proposed. In 1894, they did the first radical mastectomy that was introduced. 1896, an oophorectomy is found to reduce tumors in advanced breast cancer. Radiation was used to shrink tumors in the early 19th century. Modified radical mastectomy was developed, and chemotherapy was introduced in 1940. And the first mammogram that detected breast cancer was in 1962. 20th century treatments for breast cancer, personalized medicine, surgery, and adjuvant treatments are individualized for each patient. In 1977, tamoxifen was first approved by the Health Canada for use in metastatic settings. It was finally approved for use to prevent reoccurrence of breast cancer in 1998. And in 1999, Herceptin was approved by Health Canada. Progressive breast cancer treatments are more personalized. medicine, surgery, and adjuvant treatments tailored to each patient. Tamoxifen was approved, like I said, to for use by Health Canada for use in metastatic settings. In 1979, the first modern autologous breast reconstruction is performed, and then tamoxifen, like I said, was approved for use to prevent reoccurrence of cancer. And Herceptin, that was in 1998. And in 1999, Herceptin was approved by the Health Canada. They use Herceptin to treat HER2 cancers and triple negative cancers. And on this picture right here, this understanding precision medicine is more cell mediated, like targeted T cells to fight the cancers. My alternative treatments was immunotherapy, because with that is practiced it's not available in the state of Nebraska. It's available in Texas, and it's available in New York and some other cities, where they can specifically strengthen T cells to boost the immune system and fight off cancer cells, and they have been having some success with that. There's no adverse reactions like you would get with chemo. And this is just showing odds of becoming a survivor. There are survivors. There are 3.5 million survivors in the cancer survivors in the United States currently. Funding. I looked at funding. There are many nonprofit organizations that will help with research. There's clinical trials available in some hospitals, and Susan G. Komen Foundation has many areas for raising monies to fund breast cancer research and help with like medications and tests. Nebraska has Every Woman Matters, and Methodist has a van or a bus that they go around and they do mammograms for women that can't afford it. They will offer free mammograms for low-income women and women without health coverage. And there's an organization called the Tutu Project, which will provide monies in the form of grants, but you have to apply for it every year, to help with cancer-related issues. There's GoFundMe crowding funding. It's another way to obtain funding. And Fred and Pamela Buffett Cancer Center have resources that they just opened. And my resources and support group that I was talking about was the Susan G. Komen Foundation, the American Cancer Society, the NOAA Center, North Omaha. That's a good way to get the word out in the African community. I'm sorry. And Hope Lodge is a lodge where if you had to undergo a cancer treatment through the American Cancer Society, they will help you stay. If you don't have no place to stay, you could stay at Hope Lodge. And there's 3 offices that the American Cancer Society have. One in Kearney, one in Omaha, and I think the other's in Lincoln. That's the end of my presentation. Thank you for listening to me.